Okay.
We're recording.
All right. Good morning. It's April 5th, and this is Senate Health and Welfare. We are today looking at H225, which I believe has been voted out of rules to the Judiciary Committee from the House. This is a bill dealing with buprenorphine and access to buprenorphine for those who have are addicted to various opioids. So, Michelle, thank you for being with us this morning. This is a pleasure.
Nice to be here.
No, I think we did look at H225 last week with the Judiciary Committee, and I know that they've made some suggestions for improvements to the bill. And I'm not going to assume that they're going to pass the bill out as you go over it, but I think the changes that they've made may help us go forward. So Michelle, why don't you take us through the bill? We have it on our webpage, and we have the changes that are being recommended by Senate Judiciary to this point.
So I'm sorry, can you remind me, do you guys like for attorneys to share the screen and pop it up? Or would
Yeah,
you?
sure. That's good. That's good.
Okay.
And then what we do is if anyone has a question, they just sort of speak up because we can't see everybody.
Right. So can everyone see the draft?
Yes.
Okay, so I did send this out. I don't recall because time is all blending together at this point in the session a few days ago. So this is not changed from the version. If you did open up what I sent out to both your committee and Senate Judiciary a few days ago, this is the same one. So I haven't made any additional changes. And I have highlighted, so you should have the document up top, and it's dated 4:30 at 9:56 in the morning. And so I've highlighted the language that is new. And in section 1, it's just changing the previous language that came over from the House, used the word decriminalize. And Senator Sears was concerned that was misleading in the sense that it sounded as though maybe that it was still illegal, but there were civil penalties instead of criminal penalties. And so so we just changed that to remove criminal penalties for possession, is what he had asked for. Section 2, there are no changes. So that's the heart of the bill. And then after I show you the other ones, we can, if you want to go back and really talk about that, we can. Section 3 is a repeal. And so for those of you who have, been in the legislature for a while, we used to do it really short and just say, the earlier sections are repealed on a certain date, but now what we have to do is actually repeat that language, which is, will be law at that time, and then strike through it the way we would normally. So that's just what that is it's a repeal. And you'll see that down in the effective date section, the intent section and the exemption for BUP takes effect on passage. That is a change from the House version. They had it on July 1st. But Senate Judiciary said, well, if it's if it's going to save lives, then let's get it into effect as soon as possible. So changing it from July 1st to effective on passage. And then the repeal takes effect July 1st in 2023. So essentially a little more than 2 years out, that would be repealed unless you take up the issue and look to either, bump out the sunset or make it permanent.
Okay. Michelle, do you mind going back through the sections on possession? So I think it might be helpful for us to review what happens to someone who's under 23 or under 16 who has, and then those who are older, just so we have a clear understanding of what we've looked at previously. That's on the stuff on page 2.
Right. So page 2. So what you have in subsection A addresses 21 and older, because you have the carve outs for the under 21 below. And so right now, the way that the penalties work for for possession, for dispensing and sale, although we're just talking about possession here, is that the penalties increase depending on how much you have. So the more you illegally possess, the higher the penalty. And so in this particular statute is a catch-all for depressants, stimulants, and narcotics for all the various ones out there. And they use a benchmark system for upping the penalties. And that's the benchmarks are adopted by rule by Department of Health. And so they establish what a benchmark is for each drug out there. And so it's currently, and has been for a little while, 36 milligrams for buprenorphine. And so this distinction under current law between a 1-year misdemeanor possession of buprenorphine without a prescription and the felony level possession of buprenorphine without a prescription is 100 times the benchmark. So that's the threshold there. So you'd be talking
Wait,
36.
a second.
I'm sorry.
Oh, Michelle, I lost you for a second, but it might be
Oh.
on my end. So I just missed what
Oh,
you
sorry.
said the last few sentences. I'm sorry.
That's okay. So did you hear about me talking about the benchmarks?
That's where I lost you.
Okay, so right now, the Department of Health has the benchmark at 36 milligrams for buprenorphine. And the distinction between misdemeanor possession and felony possession is 100 times the benchmark. So that's when you get into felony level. And so that's 3,600. So anything under 3,600 is a misdemeanor currently. What the bill does, and the Senate Judiciary didn't change the amounts at all from what came over from the House, is that if you possess 224 milligrams or less, then there's not going to be any kind of penalty. There will not be a criminal penalty or a civil penalty if you're 21 years of age or older. So if you have 225 milligrams up to 3,600 milligrams, that's still going to be a misdemeanor. So the vast majority of that range is still going to be criminalized. It's taking out I didn't do the math, but 224 out of 3,600 is so it's a fraction, and taking the penalties away for that. So that's for the 21 and older. Then you'll see that for subsection C addresses the under 21s. And so the first one in subdivision C1 is for those folks who are 16 to 20. And that is the range. This is modeled after what we do for underage cannabis possession and underage alcohol possession because of the 21 distinction. And so if you're 16 to 20 and you have the 224 milligrams or less, then you would be referred to the court diversion program for enrollment in the youth substance misuse awareness. I can't remember, it's changed the titles, but I think
Right.
you talk about. There's a program, and so court diversion is run by the Attorney General's office. And that program, that youth program, is run out of their office and by Willa Farrell. And so you would be referred to that. And so let's say you had someone who's 18, they get caught with a couple strips. The way that it works is that the law enforcement officer would essentially write them a ticket, referring them to the diversion program in that county. And they have 14 days in which to contact the diversion board in that county. If they do not, and they just, ignore it, then it gets referred to the Judicial Bureau because it's a civil violation. It's not a criminal violation. So it would be referred to the Judicial Bureau, and the penalty for just blowing it off, or if you kind of initiate diversion, but you just don't do what they ask you to do, you don't complete your contract with them. For a first offense, it is a civil penalty of $300 and a loss of your operator's license for 30 days. For a second or subsequent offense, it is $600 and a 90-day suspension. So that's if you just blow it off or you don't complete. If you do reach out to the diversion board and you enter into an agreement with them and you complete the terms of that successfully, then there is no civil penalty to pay. There's no loss of your operator's license. And there's no, basically there's no record of that, that can be accessed by the public with regard to diversion. So it's all confidential. So that's the process for 16 to 20-year-olds. If you're under 16, then it's going to be considered a delinquent act. And so that child would go through family division and with a delinquency, and that would enable DCF to be providing any potentially that might be determined that might be needed for that youth. And that's it.
Okay, thank you. I'm glad we went through that. I think it's very helpful just to have the benchmark of what's happening. So I have jets going over, so I'm not going to hear anyone when you talk, even at the highest volume. But are there questions?
Yeah. Senator, could I please?
I
Michelle?
can hear you now.
Thank you. Could you just go over the under 16 again? It would be a delinquent act going through family division, and what then would follow up?
Everything is confidential. They would do, and I typically don't work on the juvenile stuff, so I'm not as well versed in it. It's been several years, and Brendan's been working on it more recently. But so going through, so if that same person was, older and they were in violation, they would go through the criminal division of the Superior Court. If they're under there, then it's designated specifically as a delinquency. And then what happens with juvenile division is that they're going to assess, they're going to be looking at the complete picture of the situation and how to address that particular situation for that child. And the key part, my recollection of why they brought that piece back in for cannabis, because years ago in 2013, when you decriminalized, not legalized, but decriminalized cannabis, the thinking there was to get rid of that delinquency, that it wasn't in the best interest of kids to go through that, and you should have the younger kids go through diversion as well. And then the AG's office, I think last year or the year before, came to the legislature and said, actually, we think it's a better approach to have those younger kids going through family division as a delinquency in order to be able to access any services that might be available from the state. Whereas if it's just a civil violation where they're ticketed and it's up to them whether they call the diversion board, maybe they don't even tell their parents what happened and the ticket goes on the bottom of the back seat, of the car, and then it's done, is that this is kind of saying, well, for those younger kids, we need more supervision to make sure that there's follow-up there. And so they chose to do that through the family division, and kind of so they can take a good look at that case. I will say that I haven't heard from any of because this is the third year in a row that I've been that there's been hearings on this particular bill. I haven't heard any of the law enforcement or state's attorneys talk about any of the people that they have found as being really young, just as an FYI. I think it's there so that there's a process, but I haven't heard of anybody saying that they've encountered that kids that young with the beep strips. So
Thank you.
Go ahead, Senator Hardy.
Thank you. And my internet is unstable, so I might go in and out, unfortunately. But but this process that you just described for people under 21, it's equivalent to what happens with alcohol and cannabis, right? So it's not a new thing that we're creating specifically for BUP. It's okay.
Right, no, it's plugging into the existing one, and the alcohol one has been, I mean, it's evolved over the years, but they've had that as long as I've been working in the legislature, so since the 90s, it's longstanding, and then, you know, cannabis got added when they
Okay.
deemed and legalized, and so it's pretty well established.
Okay, and the amount, the 224, my recollection, and I don't know if you remember, but it's about a week's supply.
days.
Is that 10 days? Okay,
That's
And
what I
then-
heard, like a week to 10 days.
okay. So it's a pretty small amount. And then I know that, you know, my personal opinion is that we should just do this. But I also understand that repeal has been helpful to get some of our colleagues to feel more comfortable with it, and some of the people who were not as comfortable. So if that's true, that's great. I wonder if there was a conversation, Michelle, in judiciary about any kind of report back or anything like that, or if that would be helpful.
They didn't talk about that, and I'm guessing it's because I'm not sure who you would have report back.
Fair.
know,
Okay.
I think you got a taste of the witnesses and everything when you held that joint hearing, and it's really kind of an anecdotal thing from law enforcement and state's attorneys and substance misuse providers, kind of saying this is what we're seeing. You know, we're really there. You know, we haven't really heard anybody that's really going after a lot of these cases. Sometimes they get prosecuted, but it's very fact specific. So there's not really like one entity, you know, that
Right.
you could look. So it's like what you'll do is when it comes up for in 2023 and that year is, you know, we'll do this again and have folks in, you can, you know, we can ask the Center for Crime Justice Research, what's the data, how many, you know, have been charged, you know, how many, and Willa can come in and say, this many people have been referred to diversion, you know, that kind of stuff. And then you'll just kind of assess how it's working out there. But I can't really think of anybody that could
Okay.
kind of one-stop shopping for a report.
Right.
But
That
they-
makes sense.
yeah,
But there
if-
will be people who will be able to talk about, you know, the experience of what we as a state have seen.
Right. I'm thinking that your providers are going to be the ones that can really talk about what's going on because they'll see it, you know.
Right.
So,
with
yeah, and
clients.
just to
Yeah.
sort of swoop this back into our jurisdiction a little bit, within the hub and spoke and within our DAs, there are certainly people who we've heard from who have helped kids and others who have accessed buprenorphine and has made their lives the addict, those who are addicted with this chronic illness, so have helped them. So, but the other thing is that I've already, I've been thinking about this, and I've asked Katie McClinn to begin drafting legislation that we all can look at next year that would maybe make some improvements within the hub and spoke and the DA system itself, so that we don't run into the situation of determining whether or not it's legal or illegal to be helping people. So, and the other thing is that we should know is that the FDA has now changed, or Health and Human Services is changing the prescription guidelines for our MAT. So that, and it will affect our hub and spoke. It'll affect the people who can prescribe, and we're going to have to evaluate those guidelines with respect to what we do in the state. So I just started reading those yesterday, and when we pick this up again, and we will pick this up again because this is a chronic problem in our state, we'll be able to evaluate what we're doing and how best to improve it. So but I guess, Michelle, this is really very helpful. And I do have one question about the judicial side of it. And that is, as we're expanding our court to for 17 and 18-year-olds, Was there any discussion in judiciary about that? I mean, this is 16 as the cutoff date, and yet we're talking about some changes to our court system for 17 and 18-year-olds. And is that in any way going to affect?
No, I think what they were trying to do is follow the existing model for
Yeah, okay,
and using that 16, because remember, it's not the difference. So if you're 17, it's not the difference between getting the benefit of the juvenile court versus being treated like an adult in criminal court. It would
yeah.
be 17, it's not a crime, it's not a
Mhm.
delinquency, it's a civil violation that you actually have the opportunity to get out of the monetary penalty.
Okay,
And so,
okay, that does make sense. Now, the only substance that now continues to be treated differently is tobacco. Purchase, use, and possession of tobacco still carries the penalty and fine, so
It's a-
maybe when
what is it? Is it still criminal?
I'm trying to remember, but I know when we went through our S-24 bill and now it's sent over to economic development, they were going to evaluate the purchase, use, and possession. So
Hmm.
I think it's still illegal. We'll have to,
It might be like a relic from
it
before
is a relic.
before we established the judicial bureau, and everything used
Yeah.
to be crimes before we started kind of teasing the low level stuff out.
Yeah.
Right.
So,
Right.
so committee, just Senator Hooker, go ahead, and then I have a
Thank
question.
you.
Yeah.
This just goes back to the diversion piece. I know that one of the concerns of law enforcement and the Department of Health was that there's an opportunity missed for directing people who are found in possession to treatment. And I'm wondering if in diversion, do they have those opportunities?
Yes,
Yes.
yes.
Yep.
That's
Yeah,
the value.
I think they do a health and needs screening, and then
Yeah.
they craft the contract with that person based on information specific to that individual, because they want to whether or not that person is struggling with a substance misuse disorder, or if it was kind of like a one-off, partying with some friends, but not a chronic issue or things like that. And that will direct the agreement, the contract with the person.
Right, it's a well, could be called a pre-trial assessment or a so the assessment that goes on is pretty clear for the individual. And we did work on that in this committee a couple of sessions ago and help work together with judiciary. That was a very exciting opportunity. Senator Terenzini.
Senator Lance, correct me if I'm wrong, but when we heard from Michael Sherling, he was concerned about the possibility of people buying this on the street and not exactly knowing what they were getting and so on, correct?
Yes, but also remember that buprenorphine is not a street drug per se. People access it through what's known as diversion, where someone will have a prescription for it and will share it with a friend or someone else. It's not one of these things that comes in big batches into the state to be sold, at least currently. So the concern about having it be contaminated in some way with fentanyl probably has not been borne out for buprenorphine. But, I suppose that you could say, well, this will open Pandora's box, but I'm not, I'm not agreeing with that assessment at this point. So. But we each have to make that decision separately. So,
Yeah.
Michelle, did you want to add anything on that one or not?
I'm sorry, me?
Yeah.
Oh, sorry. No, I mean, y'all probably know more about the actual drug than I do, but my understanding is that what they see most frequently are the strips. And not that there couldn't be a very creative illegal enterprise out there manufacturing illegal strips, but generally it's, they're self-contained, they're, like the strips you put on your teeth. And so I think,
And yeah, they're not, it's not a drug that comes in bulk and then is portioned out and sold.
right.
Yeah.
Yep.
So, yes. So, and the other thing that we have heard, and I think I asked Nellie to put Brenda Siegel's information up. She also included a lot of the information that I sent to you last week from the House Human Services testimony on the bill in 2018 and 19. So we've had a lot of information about the drug itself. It doesn't cause people to crave more. It is pretty, once you get a dose, it's pretty static in its effect. So it holds you at a level that doesn't allow for increased use. That's a benefit. And it also is one of these things, drugs that helps people as they go through treatment and counseling, and to move them off of their addiction. And also knowing that recovery can take as long, can take 7 to 9 years. So which would you rather have, I guess, becomes the question. Someone who continues to seek out an opioid in their addiction for those drugs, or maintaining some status on buprenorphine. Oh. Senator Hooker, Hardy, sorry.
That's okay.
I was looking at Cheryl and I said,
It's the
I
H's.
saw your
Fine.
hand. Okay.
I was just wondering if we're going to take a vote, or how you wanted to
Yeah.
proceed to let judiciary know our opinion.
So my question is, I'm open to taking a vote to support the bill as it currently stands and the direction they're going. If you would like to take a vote, we can do it just a voice vote and by hand. We don't need to have a formal vote. So, and unless I hear further discussion, is there further discussion? Okay. So I'm gonna play Josh for a minute and just say, all those in favor of supporting the judiciary proposed amendment, just raise your hand and say aye, please.
I
Aye.
Senator Cummings is on the phone, so I don't know if she heard.
Okay. Okay. Well, let's wait till let's give her a minute on the phone. She's got so much going on with finance. Josh, are you voting in the negative on this one?
I think I'm going to say no on this one, Senator Lyons. I have, mixed feelings on it, and I think I'm a no at this point.
That's fine. I would encourage you to read some of the information that we received from some of the physicians involved in treatment of these patients and how they have viewed access to buprenorphine. That for me is also very compelling. And then understanding that we do have a long wait, we do have a wait list in the state right now. I know there was some differences of opinion about that, but the people who work in our DAs and our recovery centers do see a wait list for medically assisted treatment for MAT. So I think we need to keep that in mind as well. And then the other thing is it does sunset in 2023, and it allows for us to think creatively about improving our system of care for people who have this chronic illness.
And
Senator Hooker.
thank you. And just to follow on that, with regard to access, we are in better shape than the average in the country, but we're still only reaching 3 out of 10 people, by some reports. And I think even the hub and spoke model, as good as it is and as good a model as it is for the rest of the country, We're a rural state and it's still difficult to get to those places in time.
Yeah,
I'm-
that was a surprise to me actually about folks down in the southern part of the state having to drive 2 hours. Because we worked really hard to resolve that problem, but so that's in our future. Trust me. This is in our future. Senator Cummings, are you still on the phone? Shake your head, yes. Yes, Senator Cummings, if you support the judiciary proposal of amendment, please raise your hand. No, she can't hear me. She's busy. Okay, well, we have a 3-1-0 support of the proposed amendment from judiciary. I'll let Senator Sears know. And then, and Michelle, you are welcome to also share that with him. And
I think they have it set for discussion and possible vote on Friday morning.
okay. All right, so, and then this meeting will probably, is probably not an acceptable meeting. Nellie's just informed me that our guidelines